Hey everybody, we are back for our second week of doing Tooth Talk Tuesday, where we answer some questions, really common questions that I get in the office all the time about dental health, oral health, that kind of thing. I'm going to jump right into it. Our second question this week, I get it all the time when we're sitting in with patients, is, hey, what kind of toothbrush should I be using? What kind of toothpaste, floss, that kind of thing? What's the best thing for me to use at home? Quick answer and the short answer, honestly, is use whatever it is that you will use regularly at home, because it's much more important that you're establishing a daily hygiene regimen and following through with that really consistently. The specifics of what type of brush or toothpaste are not quite as important, but let me give you a quick rundown. Let's talk about toothbrushes first. We'll do a future post to talk about the difference between manual and electric toothbrushes. Let's talk about regular ones. If you're going to use a toothbrush, get a soft or an extra soft toothbrush. Medium and hard brushes used to be really popular, but they can be really, really abrasive. So make sure you're using a soft bristle brush. Now, the type of brush that you use is not as important as how you're using it. Most people take a toothbrush, and when they brush, they just kind of go back and forth really quickly. They go right across the front, and then they're done. Don't do a sawing motion back and forth. If you've been in my chair, you've heard me say this. Brush your teeth with a pattern. Start with your upper right, and rather than working back and forth, make small circles. That type of motion. See how informative this is? Working up towards the front. Those small circles will get the bristles in between the teeth a little bit better, but they also massage your gum tissue to keep that healthy. Once you've brushed the outside, flip the brush over and work the inside of the teeth. Go upper right, upper left, lower right to get all the surfaces clean. Brush the grooves, and also I recommend brushing the tongue. That's where a lot of bacteria get trapped, is in the spaces around the tongue. So that's a little bit about toothbrushes. Soft bristle brush, make that circular motion rather than sawing back and forth. Now, second thing, I get a lot of questions about floss. What kind of floss should I use? My answer is the same. Use whatever you like and whatever you use regularly, but make sure that you're using it the right way. Most folks make one particular error. When they go in between the teeth, they tend to go straight in and straight out. I don't want you doing that. Think about when you get out of the shower and you shimmy down with the towel, you should be making that same motion with your floss. Otherwise, you're missing a lot of surface area on the tooth. So go in between a tooth and wrap that floss around it and work in and out. So if you're going to use floss, that's the way to go. Now, I know a lot of people don't like floss. One of the things I love to use in the office is called a soft pick. It's made by gum. It looks like a little toothpick with a little silicone bristle on the end. I like using these at home to work in between the teeth, just like a toothpick. Work straight in and straight out. The benefit here, this is going to massage the gum tissue and make it a little bit more resilient. And if you notice a lot of bleeding whenever you brush or floss your teeth, like I do sometimes, I use these, and it's incredibly helpful on limiting the bleeding. So with floss, either wrap around the tooth with regular floss or use a soft pick. It can be really helpful. And then I get all kinds of questions about toothpaste. The truth of the matter is, just about anything will work just fine. What's more important is the mechanical motion of you brushing the teeth and then coming back in and flossing. Now, there are two exceptions to that, though. There are a couple of specific purposes where I recommend a specific toothpaste. If you have trouble with sensitivity, sometimes that comes from root surfaces that are exposed. Some people's teeth are a little bit more sensitive, and the toothpaste specifically made for sensitive teeth can be very effective. So Sensodyne, Crest, Oral-B, they have their own lines of sensitive toothpaste. That can be helpful, but we want to make sure we know why the teeth are sensitive. So I always recommend that you come in for an exam so we can figure out a reason why you're having that hot or cold sensitivity, because sometimes it's something that toothpaste is not going to help. But if it's just a simple case, some of those Sensodynes can be helpful. A second case where I recommend a specific toothpaste is if you, or especially your child, are very prone to getting cavities. Sometimes we need to do a toothpaste that has a higher concentration of fluoride to help remineralize those teeth. It makes them much more resistant to decay. So other than those two exceptions, pretty much any toothpaste is fine, because as long as you're brushing and flossing well, the toothpaste doesn't really do much more than taste good. So just as a reminder, if you're getting a toothbrush, you want to get a soft or an extra soft bristle. For flossing, use whatever it is you're going to use, or try those soft picks. And then with paste, regular over-the-counter is best for most patients. unless you've got those specific cases where Sensodyne or a high fluoride toothpaste can be helpful. So hopefully that answers some questions. Feel free to comment on this post if you have other questions you'd like for us to answer next week, or send us a message on Facebook, and we'll be sure to answer those when we're back next week for our next Tooth Talk Tuesday. So have a great week, y'all.